Hey everyone, we have another high-yield case for you to help you with your diagnostic skills. This case begins with a 7-year-old boy who was brought by his parents to the emergency department because of fever of above 103 degrees Fahrenheit for the last 6 days, a rash, macular papilla that's on his chest, dry cracked lips, and a strawberry tongue, as well as conjunctival injection, meaning red eyes in both the eyes. He has no previous medical history and was healthy before this illness began. Vaccinations are completely up to date, but his vitals are a bit abnormal. He still has a fever of 103.2 degrees Fahrenheit, and his heart rate is 120 beats per minute. Physical exam is also pertinent for a finding that wasn't demonstrated in the previous symptoms mentioned, and there's a picture of it given to you. What do you think is the most likely diagnosis based on this? A. Kawasaki's disease. B. Scarlet fever. C. Hand-foot-mouth disease. D. Measles. Or E. Parvovirus infection. Were you able to figure out what the diagnosis was? The answer is Kawasaki's disease. Kawasaki's disease is a vasculitis, meaning it's an inflammation of blood vessels that has a wide constellation of symptoms that you have to memorize. These include at least 5 days of high fever, dry, fissured, cracked lips, strawberry tongue, bilateral conjunctival injection, meaning red eyes, cervical lymphadenopathy, and a macular papular rash, usually on the trunk. In addition to this, you can also get the physical exam find that we saw, which is desquamation of the palms and soles. The complication of this condition is that it can involve the coronary arteries. The coronary artery involvement can lead to acute myocarditis with heart failure, it can lead to arrhythmias, or even coronary artery aneurysms, which can be very dangerous. The treatment for this condition is high-dose IVIG and high-dose aspirin. And remember, with kids with fever, you have to be very careful about giving aspirin because of the risk of Reye's syndrome. But in this case, the risks are not outweighing the benefits, so you should give it. Hope you found this case interesting and learned a lot. See you next time.